While much of the literature on teaching methods in health professions was written with medical or nursing education in mind, it doesn't take much imagination to translate them to dental education. Outpatient environments are the norm in most dental educational programs, and well over 50% of our time with learners is in a procedure-centric setting. We'll cover some of the other differences in a moment, but first let's review the universal principles within health professions education. As discussed earlier in this module, the development of well-thought-out learning objectives is essential to both planning your teaching methods and evaluating their outcomes. Remember that these learning objectives should be specific and measurable. While there may be plenty of information that's good to know, when writing your objectives, decide exactly what you want your learners to be able to accomplish following your instruction. Limiting yourself to a few important learning objectives can help focus your lesson while ensuring that a more realistic and achievable outcome is within reach. One helpful method for structuring your learning objectives follows the CABD format, listing the condition, actor, behavior, and degree. Learning objectives can fall into a few different domains, which should influence the selection of teaching methods. Let's look at some examples of learning objectives from different domains within an Advanced Education in General Dentistry 12-month program. Cognitive learning objectives may include: given a description of patient symptoms, residents will be able to provide a differential diagnosis from among the various neurovascular headaches in the correct order of likelihood. Teaching methods effective for achieving these types of objectives could be lectures, videos, readings, and several others. Effective learning objectives may include: following the conclusion of this exercise, residents will appreciate how the ADA ethical principles apply to decision-making within realistic scenarios. Teaching methods effective for achieving these types of objectives could be personal reflections, small group discussions, and others. Psychomotor learning objectives may include: by the end of the semester, residents will be able to perform an intraoral scan with the prime scan unit that is sufficient for fabrication of a fixed dental prosthesis. Teaching methods effective for achieving these types of objectives could be patient simulators, hands-on demonstrations, videos, and many more. Although in an ideal situation, instructional methods are chosen because they are the best suited for each learning objective, the reality for many of the faculty members taking this course is that you're given less time with your learners than you would prefer, and this often will be the biggest factor when deciding on which teaching methods you wish to employ. Although there are many other teaching methods available, in the following lessons we're going to focus on just two general methods involving small group instruction and clinical instruction. It is likely you have utilized these methods in some form in your faculty experience, so we'll focus on some strategies that you can incorporate easily to improve the educational experience. Opportunities for small group educational activities are regularly incorporated in the didactic curriculum of graduate dental education programs. Since dental resident class sizes often range between 3 to 16 learners, this format is likely the most common form of classroom learning you are encountering. There are several different methods that can be used in a small group setting, each with their own advantages and disadvantages. Typical dental examples of small group learning are journal clubs, treatment planning boards, patient care conferences, case-based learning, or specialty topic seminars. Regardless of the specific method, effective exercises all share certain common features. A thoughtfully crafted plan for the session is essential, and it should begin with identifying the goals and learning objectives you wish to have achieved at its conclusion. At the beginning or before the session, learners should be aware of the objectives to encourage their active engagement. Depending on your chosen learning format, participants may have preparatory work in the form of reading or watching videos. Without adequate preparation, learner engagement will be minimal, and the session could easily fall back into a mini-lecture. Even an exciting presenter with masterfully created PowerPoint slides is less effective than a learning environment where students are active participants. In a small group setting, the ideal role of the teacher is as a facilitator. If possible, assuming a seat or position in a neutral location can help set the appropriate tone. Your chosen seat can have other impacts on the group as well. A common challenge with small groups is managing the learner who dominates the conversations. Sitting next to this type of individual can reduce inadvertently giving them increased attention through frequent eye contact. On the other end of the spectrum, a quieter learner may be encouraged more to speak up if you sit across from them. There may also be several situations when it is beneficial to have a learner be the small group leader or facilitator. For example, a second-year endodontic resident would make an excellent facilitator of a small group consisting of their first and second-year peers. There are several additional ways to improve the performance of a small group and to encourage more fruitful interactions between learners. What might sound like the easiest practice is actually one of the more difficult ones, and that's learning to be comfortable with silence. If you are posing a question, ensure that you wait for an answer before volunteering the answer yourself. Additionally, after a learner responds to a question, allow more silence to enable learners to process and evaluate their given answer. Remaining silent enables all learners to develop their thought process prior to speaking up. The facilitator of a small group discussion can take on several different roles, including that of a consultant, only participating to answer questions, a neutral chair, participating but not offering opinions, or a devil's advocate, stimulating the conversation by arguing for a controversial or unconventional position. Controversial issues can incite a very meaningful discussion as long as the ground rules ensuring mutual respect are enforced. There is evidence that the most beneficial aspects of small group environments relate to the self-directed learning that can occur. It can sometimes be difficult to incorporate self-directed learning outside of problem-based learning, but there are ways to encourage the practice in other teaching methods. One simple addition is called the most muddy point. This technique directs each learner to identify from which concept they would most benefit having further extrapolation or discussion. When facilitating small group learning, it is important to manage the time either by subtly transitioning through sections or by having an appointed timekeeper that will ensure things progress on schedule. Although a typical session would last between 1 and 3 hours, a good general rule is that the longer sessions should be reserved for those in which the students are engaged in greater amounts of active learning exercises. To learn more about small group learning in the health professions, explore some of the references at the end of this video. Hopefully with these and other tips, you will find planning and conducting small group sessions to be a very effective and meaningful teaching experience.